When you bring in a new retina drug, and I know there's a lot of new ones coming to the market, or even new drugs in general you're going to prescribe to patients, what's the first way you hear about them? What are your considerations if you're going to utilize them or not?
Yeah, so I think the first consideration with any new drug is first figure out, is it right for your practice? And so you got to look at patients, look at the data, and figure out if it makes sense to help them achieve their goals of better vision. And so I think that's where it starts. I think the next step is where it gets really tricky, and that's creating an implementation strategy, because there are a lot of landmines on the way to delivering the care that happen from once the drug's approved and we have it and you've decided it's good to use, and actually getting it in to the hands of your patients in a way that's constructive for them.
Oh, absolutely. So as a practice administrator, my big thing is always like, what's the authorization process look like, right? What's the out of pocket for the patient? When you're considering bringing in new drugs, is that ever part of your consideration, or are you really looking at clinically what is going to be the best outcome, and we're going to jump through hoops if necessary?
Yeah, no, it's great questions. So I think once you've made the decision that you want to bring it to your patients, I'm going to call it the 5 Ps, if you will, of implementing this strategy. And so first, you want to have a practice-wide strategy of how you want to do it. That's the first P,
Mhm.
and I can go into that in a little bit more detail. You want it to have a phased implementation. You want to prepare to appeal because trouble's coming. Look at patient assistance programs, the fourth P. And finally, the fifth is payer policies. So you want to monitor those payer policies. So that's kind of the 5-step approach that I would say that's going to be useful to approaching it. And each step kind of carries its own set of challenges. So briefly, I can kind of go through practice strategy. You want to do things like figure out if your EHR has the templates, update consents, get that correct. In terms of a phased implementation, for the GA trials, for instance, there were challenges of whether you want to do a dry AMD patient who also has concomitant wet AMD. And so kind of start with the easiest scenario first and then kind of build up. So having that phased implementation, I think you want to have your back office prepared to appeal, because there's inevitably, and you know this better than anybody, there are going to be challenges that happen. And it's just, you can't shy away from it if it's good for your patients, just because there's going to be the burden on the back end. I
Mhm.
do think that you just have to have that team in place. So follow up the claims, and that's especially true when there's not a permanent J or Q code, as when we talk about
Totally.
biosimilars, because I think that's where you really run into issues. Um, Payer assistance programs, they're amazing. We really they mitigate the risk for both patients and the practice. And
Mhm.
so those are useful areas to certainly kind of invest time and energy to accessing those programs.
Mhm.
And then finally, the payer policies. I think that's going to be the trickiest one. And that's one that requires constant vigilance, because you can have a payer policy that they put in place at the beginning where, for instance, in the dry macular degeneration space, all drugs can be used. And
Mhm.
then they change the rules later on and they say, well, you have to have a fundus autofluorescence before we approve it. So you got to stay aware of those changes. So to me, those are going to be the 5 keys of implementing the strategy. And it's one that I think is generalizable, because it's not just for this instance, it's for the next drug and it's for the next innovation. And as you know, in ophthalmology, that's, I think, what drives a lot of us. There's a ton of innovation, a lot of new drugs coming out. So it's exciting.
It is exciting, and I think that's a great framework for when you're thinking about what kind of drugs are we implementing in the process and how is it going to look in the first month to 6 months, right? 'Cause, it's a wild, wild west those first couple of months, and then once they get on the payer policies and you find out who's accepting and everything just kind of falls into place better.
Yeah, no, that's exactly right. The first 6 months is absolutely the Wild West. And these are approaches that still let you utilize some of these medications for your patients. After the 6 months, it's marginally less the Wild West, but you do have some coding structures in place that make it a little bit more straightforward. So I think these are the challenges that kind of continually seem to come up.
What are your tips and tricks for educating your staff on new medications that are coming? Because you're going to be recommending to the patient what we move forward with, but a lot of times they're going to ask your technicians or your front desk, "This is new. What does this mean?"
Yeah, absolutely. So this is something that we routinely go over. So when there's a new class of drugs, and we just went through this with dry macular degeneration, There's a lot of education that goes in, and that's at, like you mentioned, at every tier. I think in our practice, what I found most helpful is having the scribes really aware of the medication, why we're using it, and kind of what the process is with it. And so they can kind of help you deliver that care. But I think at the front desk end, you have to know the payer policy issues. So, for instance, for the dry AMD drugs, some of them you can use every 25 days up to 60 days. And so there's a window. And so if they don't know when to book the appointments, you end up with unhappy patients that can't be treated on the day they were booked. So it does take that multi-tiered and layered approach in terms of education. And I think, fortunately, there's usually windows when there's a burst of innovation. We can do that education. It's a great opportunity to revisit old education. And then you can kind of maybe sit back for a little bit until the next innovation.
That was perfect. And that's all of it. Did you have anything else, any other tidbits that you wanted to include that they'll cut in?
So no, I think that really covers a lot of it, and I think if you can come up with that strategy, implement those policies, and then continue to disseminate that information throughout the practice, so everyone has that, I think you really can get a good rollout with the inevitable bumps, but I think manageable bumps.
That's fantastic. You know,
Awesome.
for the side note for me is for our practice, we deal with a lot of dry eye drugs. And I feel like I'm willing to go through a whole bunch of problems and headaches for retina drugs. But if if it's going to take
Yeah.
me 6 weeks to get the dry eye medicine approved, it drives me insane.
So I mean, I think you're hitting right on it. I mean, I think it comes down to how critical it is. Is it for your practice, and how, you know, is it something that they can wait 6 months, before it rolls out
Or
and you can
not,
do it in a
yeah.
more streamlined way? Or is it something that there's no treatment for it and now you have a treatment and yeah, you got to maybe go through the hurdles to get them access. So
Yeah.
I think that's always the challenge.
And then my question for you is, you're a little bit new to AAOE, but you certainly have probably learned a lot in these early months. What is something that is just really special about what we do?
So I think AOE, if I had to pick one thing, I would say it's one-stop shopping. It lets you get everything from start to finish, and that covers whether it's on the coding side, whether it's on the delivery of care, whether it's on the back office end. I mean, there are literally tips and tricks along the way that the entire practice benefits. And I think what's really valuable, and we've certainly seen it in our practice, as you start to implement these at different levels of the practice, you can see this mass movement that happens that's much greater than the individual small changes that you're making at each of the office positions that you have. So I think one-stop shopping, that's probably my biggest benefit.
I love that. That's fantastic.
Awesome.
Well, thank you so much.